Hi there, this is Cristian from ArtSmiles. Let's discuss a few things about dental veneers and how to take care of your veneers in the long term. Okay, first of all, congratulations for your veneers. I hope you really enjoyed the results that we've got, and I always try to do my best to please our patients with the veneers, with the cosmetic treatments that we do. Right, so the veneers are very thin, as you saw in the treatment. They are very thin layers that we cover the teeth, and that's very good for your teeth as well, because we don't need to do a crown as in the past, but a crown is more extensive wearing of the tooth that we need to do to do the treatment. And veneer, we just remove, sometimes we don't remove at all the tooth, and sometimes we just remove a very thin layer of the tooth, and that's why we have usually the post-operative instructions are the same for the normal teeth. Okay, so the brushing and flossing, as you may have discussed already with our hygienists, with our health therapists, the brushing is the same as for normal teeth. So please remember, we don't want brushing like this. Okay, don't brush like this. Okay, the brush must be from the gum to the tooth, or could be in circles, but never this movement. Okay, if you brush with this movement here, you're going to create sensitivity, and you're going to create gum recession around the veneers, and this is in the long term, this is not a good result. Okay, flossing, there is a way how to floss. It's not just a matter of releasing the contact, but you need to make movements of the flossing. Okay, this is the normal routine cleaning that you need to do. It's exactly the same as we do for normal teeth. Okay, so just a few things that you should be aware of. Sensitivity is super normal. Okay, sensitivity, especially when we need to, sometimes when we need to bring back the smile a little more, I need to shave down a little more the teeth, and that's why sometimes we have more sensitivity. In these cases, what we do, sometimes I do lasers, sometimes I need to review the bite. Sometimes the bite is imbalanced. Okay, and it's totally normal to come back after the completing the treatment. After installing the veneers, it's normal to come 2 or 3 times more just to review everything, just to check if everything is good. It's just part of the job. Okay, don't think that something is wrong. No, everything is good, and we just need to it's an extensive treatment. If 0.2 millimeters, one tooth is 0.2 millimeters higher than the other, you're gonna feel it. If you use you can feel if there is a hair in your mouth, you know, and that's super thin. It's the same thing when we're with a veneer. Sometimes in the first appointment we think that everything is good, but when you go eating and using your new work, the new work that we've done, if you feel that you can start feeling sensitivity in one specific area, and that's because sometimes it's a bit higher than the others, and it's super easy to fix. Okay, sometimes the bite is unbalanced, and then it's the same thing. We need to adjust. Okay, if you feel that when you are talking, if you're biting, especially in the canines, if you're biting your teeth, sometimes the tooth is a bit longer, and this information I need to have as well. Okay, if you feel that something is not correct, just come in, and then we're gonna fix. Very, very important. Please don't think that just because you had veneers, you're not going to have decay, or you're not going to have the gum disease. Yes, you can have. And please maintain a very good oral health regime. You're not gonna get decay in the veneer, because the veneer is a ceramic. It's like a glass. So you're not gonna get the veneer in the decay in the veneer, but in the tooth, and especially in the area where we have the bond between the tooth and the veneer. So the better is your oral health, the less probable to have any problem with decay. And the other thing is as well is staining. Our ceramic veneer, not all, just ours, all ceramic veneers, they don't stain. Okay, it's not gonna attach any stain in the veneer. But if you don't pay attention, if you don't brush well, don't have a very good oral hygiene in the long term, you may have some stain in the between the veneer and in the margin between the veneer and the tooth. So that area could be a bit darker, especially if you drink a lot of coffee and you don't brush regularly. Okay, so these are most of the post-operative instructions that are related to veneers, and I hope to see you every 6 months. Please come regularly. I know that you had a more extensive treatment done, and I'm really thankful that you decided to do that with us. But please continue coming just for your normal checkups. This is important just to maintain the beauty of the treatment and your health in special. Your health is the most important, because the aesthetics just follow the health. Okay, if you have a healthy smile, a healthy mouth, you're gonna have a good aesthetics. Okay, hope to see you soon. Thank you.